Dr. Melnick, if we talk about gum disease, we have talked of how devastating just the slightest gum disease has, never mind a more blown one. And yet, of course, most of us are very afraid to have the gums cut and all that stuff. But again, major developments have been made in how to do gum disease surgery. And there are explain the 2 or 3, stages of gum disease and what type of equipment these days is used to make it, I wouldn't say pleasant maybe, but more tolerable.
Well, gum disease is caused by the excess buildup of bacteria in the mouth. While the mouth is not sterile, everyone has bacteria. When bacteria builds up above and beyond normal levels, it can turn on the mouth and cause damage. The most common understanding is bacteria can cause holes in the teeth. We call them cavities. But bacteria can also attack the gum and the bone support, the foundation of the teeth. And over time, you can go through various stages and wind up having loose teeth and ultimately teeth loss because of gum disease. In fact, more teeth are pulled in this country because of gum disease than because of tooth decay. So let's talk about that. When bacteria builds up around the teeth, it starts off as a film called plaque. Plaque is a film made of bacteria and food debris, and it's soft, and it can be brushed and flossed off the teeth. If you're brushing and flossing, but you're missing certain areas of plaque formation, the calcium in saliva can combine with this plaque and change the buildup from a soft film to a hard, crusty buildup, and we call that calculus or tartar. Now, a tartar buildup is like barnacles on the side of a boat. You can't brush it away. You can't use air. You can't use a cotton gauze. It has to be scraped away or pulsated off with a water spray. Now, as the bacteria builds up and collects to the sides of the teeth, they digest foods and they give off substances that can damage not only the teeth but the gum attachment as well as the supporting bone. And as it gets deeper and deeper, it can cause more and more infection and bone loss and infection and inflammation. So in the beginning, people will see their pink gums turn red, their knife-edge gums get puffy and swollen, bleeding, bad breath. We commonly call this gingivitis or pyorrhea. That's the first stage of gum disease. And usually we can treat this by removing the buildup that is sticking to the sides of the teeth. We can use special mouth rinses, and sometimes we can use an energized light sauce like a soft tissue laser, and we can use that between the infected gum lining and the tooth to detoxify the root surfaces to allow the patients to heal. Over time, if patients continue not to come in and get treatment and there's significant bone loss, then we oftentimes have to do gum surgery, which may involve cutting away gum tissue, or it may be reflecting back the gum tissue, cleaning everything up, trying to add bone back in between the teeth, and then sewing the gums back at a lower level. So there's everything from non-surgical gum treatment, using water instruments or hand instruments, to using energized sunlight in the form of a laser, to doing conventional gum surgery, which involves the removal of some excess gum tissue, reshaping and or adding a bone. There's a whole variety of treatments that can be done to help get gum disease under control.
Let's take some of the more severe gum disease. There's lasers out there today already. Is the patient basically ready when he leaves the office that he can functioning again normally? Does he have pain for a long time? What's the deal there with this new type of laser surgery?
Well, if you have your gums cut with a laser, we kind of call that a high-tech scalpel. In the past, if you just had a knife or a scalpel blade cutting the gum tissue, there's a normal post-op inflammation, and it's uncomfortable. The gums swell up, the gums are sore. That's where most of the post-surgery discomfort comes from. One of the beauties of using a laser light to cut gum tissue is that you don't have that post-op swelling and pain. In fact, I would say that patients that have gum treatment using the laser wind up taking no more than an over-the-counter Advil or extra-strength Tylenol if they need anything at all. It's truly a modern marvel.
Wow. And such a surgery takes an hour or two or so? Is that what we're talking about?
Well, it depends on how large the area is. I would say probably an hour.
Okay. All right. Well, laser, even in dentistry, and again, so one of the main, for the patient's benefit, one of the main benefit is the post-op. There's like, because it was cut with a laser, there's just less, if any, pain and discomfort afterwards.
Absolutely.
I'm sure that's appreciated by lots of people who are looking forward to some gum surgery. But another thing I think which should be emphasized based on what I hear you talking about, if you floss brush, if you get your regular cleaning, and at the very best, because of it, sometimes a kind of what's called a deep scale cleaning, where you scrape a little deeper, I guess. And if you do that, you really, on an average, except some bad genetic inheritance, you'll never really need such a surgery. Is that correct?
The goal of coming more frequently for patients at higher risk for gum disease is to minimize the damage done by the bacteria so that we can avoid going to the surgery steps. I couldn't agree more.
Right. And another thing to, of course, remember is what we talked in other videos is, yes, you doctors can fix it once it happens, and if you have lost a tooth or two because of it, as bad as it is, implants and crowns and bridges, it's all available and the mouth can look good again. But what cannot be reversed is the poisoning of the blood and the kidney, the liver, the cardiovascular system, the heart, the brain, and all kinds of things for years while that was going on. So that's why it should be avoided, not fixed afterwards, right?
The other thing, I agree, but if I could also add, the sooner we get to a problem, the less costly and the less advanced the treatment is likely to be.
Right. Absolutely. Prevention, an ounce of prevention is worth a pound of cure or something like that, right?
That's correct.
And it couldn't be more true with gum disease simply because of all the other problems it causes in the body. Dr. Melnick, see you later.